Hey there, and welcome to This Explainer. I'm a senior pelvic floor physiotherapist over at Ova Women's Health. And listen, if you found your way here, I'm guessing you are desperately looking for some answers. If you've been living with pelvic pain and maybe you've been told it's quote unquote normal or that literally nothing can be done, I just want you to take a deep breath right now because today we're going to unpack exactly what's actually happening in your body. So let's dive right into this, shall we? I want to start by addressing the elephant in the room right out of the gate. Pelvic pain is real, and it is absolutely not in your head. You know, so many women I see with chronic pelvic pain have spent years, sometimes literally decades, just being completely dismissed by the medical system. You might have been told that your pain is, just part of being a woman, or that because your test came back clear, you must be totally fine. But let me tell you, what you are feeling is incredibly real. You truly deserve to be heard. And honestly, you deserve a medical team that actually listens to you. Your pain has a true physical source. There is a real anatomical reason for the discomfort you're feeling right now. And whether you've been dealing with this for, say, a few weeks or struggling for a few years, I really want you to know that you're finally in a safe, judgment-free space where you will absolutely be believed. So, clinically speaking, we recognize that pelvic pain is, it's highly complex. Generally, it's any discomfort you feel in the lower abdominal or pelvic region. And yeah, that includes the perineum, the buttocks, and the lower back too. It can be acute, meaning it's short-term, or chronic, which just means it's stuck around for longer than 3 months. Your pain might be zeroed in on one highly specific localized area, or it could feel totally widespread. Maybe it's a constant nagging ache, or maybe it's intermittent, just kind of coming and going randomly throughout the month. And very often, it severely interferes with your everyday life. I'm talking about things like sitting at your desk, standing up, going to the bathroom, or intimacy. Section 1. Causes of pelvic pain. Discovering the root of your discomfort. Figuring out the root of your discomfort really means acting a bit like a detective. And that's because the pelvis is just this incredibly intricate area of the body. Your pain could stem from muscles, nerves, organs, your posture, or even a crazy mix of hormonal factors all interacting together. Pelvic pain is honestly just a giant umbrella term. So let's look at some of the specific conditions we see and treat literally every single day at Ova Women's Health. We're talking about pelvic floor dysfunction, pudendal neuralgia, vaginismus, endometriosis, interstitial cystitis, which you might know better as painful bladder syndrome, and of course, postpartum pelvic pain. Oh, and it can even stem from digestive stuff like IBS or chronic constipation, just putting way too much pressure right on the pelvic floor. Now, a question I get asked constantly in the clinic is how do I actually know if my pain is muscular or if it's nerve-related? Well, the sensations are actually quite distinct. Muscular pain usually feels a bit like a deep pressure, a real tightness, or this dull aching that tends to get worse with physical activity or when you're stressed out. But on the flip side, nerve pain, like pudendal neuralgia, which is where the nerve running right through the pelvic floor gets super irritated, that's almost always described as a burning, tingling, or kind of a shooting sensation. Sometimes it just feels like severe hypersensitivity. And a major contributor to either of those pain types is pelvic floor dysfunction. This basically happens when the pelvic floor muscles become either way too weak, we call that hypotonic, or, and this is super common, they get way too tight and overactive, which is called hypertonic. When these muscles are just gripping onto tension and they simply cannot relax, you're going to experience symptoms like pain while just sitting or standing. You might feel discomfort during or after sex, straining or difficulty when you're trying to pee or have a bowel movement, or even just this dragging feeling of heaviness right in the pelvis. Okay, I really need to emphasize a crucial truth here. Debilitating period pain is not normal. Let me say that one more time for the people in the back. It is not normal. Did you know it actually takes an average of 7 to 10 years for women to get an endometriosis diagnosis? 7 to 10 years. While sure, some mild cramping is totally expected, severe menstrual pain, dysmenorrhea, the kind that leaves you totally unable to function or sends pain radiating down your thighs or makes you nauseous, that is a massive red flag. It's often a sign of underlying conditions like endometriosis or hormonal imbalances. Please do not let anyone minimize that pain. So here's another incredibly important question we definitely need to cover. Can stress make pelvic pain worse? The short answer? Absolute yes. No doubt about it. You see, when you're stressed, your body dumps hormones like cortisol into your system. This throws your nervous system into high alert and actually cranks up muscle tension all over your body, but particularly right down there in the pelvic floor. It's basically an involuntary guarding response. Your body is trying to protect itself. And all that extra tension, it can drastically worsen your pain, your urinary urgency, and your bowel symptoms. Section 2. How physiotherapy treats pain.
a holistic, evidence-based approach.
All right, now that we kind of understand what's actually causing the pain, let's pivot and talk about the solution. I want to walk you through what your actual evidence-based treatment journey looks like with us, step by step. First things first, we start with a comprehensive assessment. This is an unhurried, super detailed chat about your history and symptoms, plus a physical evaluation of your pelvic floor muscles and your posture. Next up is hands-on manual therapy to really help release that tension and get your mobility back. After that, we use biofeedback training. This is a really fantastic piece of technology that actually lets you visually see on a screen how your pelvic floor muscles are activating and relaxing, which helps you regain control. And finally, we introduce tailored movement retraining. We give you specific exercises to build up weak muscles or chill out the overactive ones, all while properly supporting your core.
But hey, I know exactly what you might be thinking right now. It's honestly a very, very common anxiety for my patients who've been dealing with chronic pain. You're probably wondering, is pelvic floor physiotherapy going to be painful? And I completely get it. If you're already hurting, the mere thought of someone examining or treating that sensitive area can be downright terrifying.
So, I want to promise you this right here and now. Treatment is gentle, it is safe, and it is tailored entirely to your personal comfort level. Pelvic floor physiotherapy should literally never be painful. The hands-on techniques we use, things like myofascial release, trigger point therapy, and nerve mobilization, they are always performed within your own tolerance. Your therapist is going to walk you through every single step before it happens, use relaxation-based methods, and basically just make sure you feel totally safe and supported the whole time. You are always in the driver's seat.
Section 3. The OVA approach. Why specialized care matters. Look, general physiotherapy is absolutely wonderful if you've got a sprained ankle, right? But chronic pelvic pain? That requires a highly specific multidisciplinary approach. You really need a clinician who completely geeks out on and understands the complex interplay between your pelvic organs, your nervous system, and your musculoskeletal system. And honestly, this is exactly what we do at OVA Women's Health Physiotherapy over in Burnaby, British Columbia. At our clinic, complex pelvic pain isn't just some side service we offer. It is our absolute specialty. It's what we do. And we're one of the leading pelvic floor clinics in BC for a reason. We're true experts in both acute and chronic pelvic pain, and we're all about providing evidence-based, patient-centered care. Because of our team's extensive experience, we've encountered virtually every type of pelvic pain case under the sun, including the really complex and challenging ones. Our entire focus, our absolute dedication, is just restoring your comfort and getting you back to living a normal, pain-free life. Section 4. Taking the first step. You don't have to live with pelvic pain. I am speaking directly to you right now. You do not have to live with pelvic pain. I know it can be exhausting. I know it's life-altering, but you deserve to feel better, and evidence-based treatments really do exist to help you recover. Please, whatever you do, don't suffer in silence any longer, assuming your pain is just untreatable. Early intervention is just so absolutely crucial because it stops your nervous system from locking into those nasty chronic pain patterns and secondary muscle guarding. Trust me, getting an assessment early helps drastically reduce those awful flare-ups and ensures a much faster recovery so you can get back to being you. So, if you're ready to begin, go ahead and grab your phone and just scan the QR code you see on the screen right now. Space at the clinic is limited, but this code is going to take you directly to our booking page so you can lock in your unhurried, completely confidential first consultation. I promise you, your first appointment is just going to be a warm, simple, and entirely judgment-free conversation where we finally start getting to the bottom of what's actually going on.
You know, you have been patient long enough. Specialist help really does exist, and your healing journey, it starts with just one single appointment. I want you to imagine for a second what your daily life would look like if you didn't have to plan absolutely every single moment around your pain. Are you ready to find out? Thank you so much for joining me for this explainer today. We really look forward to welcoming you to OVA Women's Health soon.